barriers include the fact that the level of know-how about this disease amongst practitioners is kind of limited. What we've learned over time with this disease is the earlier we start the treatment, the better. But a good number of these patients with ATTR-CM, they are often misdiagnosed as having either hypertrophic cardiomyopathy, hypertensive heart disease, and um, some might be misdiagnosed as having ischemic cardiomyopathy, maybe because they had some type of ischemic event in the past, but that does not preclude having, ATTR-CM. So many of these patients do go for many years undiagnosed because a good number of them are actually in primary care offices. So the big barrier, in my opinion, is really the fact that a lot of we still need to educate more, get more practitioners to be able to recognize this disease, and of course we need to educate our patients as well, because the symptoms can be they're basically similar to what we see in many other conditions. So it's kind of difficult sometimes to know unless you really understand this disease to be able to separate them from other causes of heart failure.
Indication and important safety information. Indication. Attruby, acoramidis, is indicated for the treatment of cardiomyopathy, of wild-type or variant transthyretin-mediated amyloidosis, ATTR-CM, in adults, to reduce cardiovascular death and cardiovascular-related hospitalization. Important safety information. Adverse reactions. Diarrhea 11.6% versus 7.6%, and upper abdominal pain 5.5% versus 1.4% were reported in patients treated with Attruby versus placebo, respectively. The majority of these adverse reactions were mild and resolved without drug discontinuation. Discontinuation rates due to adverse events were similar between patients treated with Attruby versus placebo, 9.3% and 8.5%, respectively. Laboratory tests. Mean increase in serum creatinine of 0.2 and 0.0 milligrams per deciliter, and a mean decrease in eGFR of 8.2 and 0.7 milliliters per minute per 1.73 square meters was observed in the adults with ATTR-CM treated with Attruby versus placebo, respectively, at day 28 and then stabilized. These changes were reversible after treatment discontinuation. Use in specific populations. Pregnancy and lactation. There are no data on the use of Attruby in pregnant women. Animal data have not shown developmental risk associated with the use of Attruby in pregnancy. There are no available data on the presence of Attruby in either human or animal milk, or the effects of the drug on the breastfed infant or maternal milk production. Please see full prescribing information for Attruby at attruby.com/PI.